nurses around the state what's going on if they have any concerns.
Okay. They're hearing you, so you can,
good. Yep.
so they can take that in as they're listening to your
my jabber at the very beginning, they'll file that away. Okay, you all, you heard that. Be thinking of some questions. Not hard ones, not hard.
Okay, we will go ahead and get started. So we're in the 2:15 to 3:15 p.m. Oral Health Connections, linking education to practice. I know most of you guys have been in these sessions, so the only thing I'm going to repeat is after the conference, a link will be emailed to you for an online evaluation, and an online evaluation must be completed for each qualifying session within the 2 weeks of the date the evaluation link is emailed. And after you complete that the evaluation, a CEU certificate will be available for you to download. So, hello everyone. So our next speaker is Gina Sharps. Gina, I don't know all these initials, so you may have to.
It's okay. You're probably seeing MPH, Masters of Public Health, RDH, Registered Dental Hygienist, and the CTTS is the Certified Tobacco Treatment Specialist, which is a certification through Mayo Clinic.
Okay.
Yeah.
So Gina is an oral health educator at Marshall University School of Medicine and the coordinator for the West Virginia Oral Health Coalition. She also serves as West Virginia's dental hygienist liaison, a partnership between the National Center on Health, Behavioral Health, and Safety in collaboration with the American Dental Hygienists Association and the Association of State and Territorial Dental Directors, and currently holds a position on the West Virginia University School of Dentistry Alumni Association Board of Governors. Woo! Gina is the current legislative liaison for West Virginia Dental Hygienists Association and a past president of WVDHA. She has served on the Health Resources and Services Administration's Medical Dental Advisory Committee and currently serves as a consultant with the ASTDD, along with serving on the ASTDD Fluorides Committee. So I don't know where my other paper is though, Gina, so take it away.
You got it. That was fantastic, Carol. And talk about alphabet soup, right?
Yes.
Oh my goodness. So good afternoon, everyone. And for those of you who were logged on a few minutes early, Carol and I were chit-chatting, and I do want to just take a moment to formally thank Carol for inviting me to present and spend time with you all this afternoon. It pains me to be talking to a screen and not see your faces and be there in person with you. But we'll do our very best to get through this. And then maybe next year, we can be together in person. I surely hope so. So I'm just going to buzz through a little bit about myself. I grew up in West Virginia. I'm a local yokel. I grew up in Taylor County. I'm still here in Taylor County. I went to school at WVU School of Dentistry, graduated with a degree in dental hygiene years ago, spent about 13 years in private practice, and then just had some serious professional burnout. Went back to school, obtained a master's in public health in 2012 at WVU. And Carol shared earlier that I had the opportunity, it was a great honor to serve on the HRSA Medical Dental Advisory Committee. And now I'm at Marshall University School of Medicine. I do some consulting work with the Association of State and Territorial Dental Directors, as Carol was mentioning, and then some affiliation with our Dental Hygienist Association. So that's a little bit about me professionally in my career. And I hope you're laughing at these when you see them, because they made me laugh really hard. I've spent some time in your all's offices. Some of the nurses that here in Harrison County, I live in Bridgeport. I'm in Taylor County, but right on the Harrison County line. So I have quite a few really good nursing friends. And oh my gosh, is this not the truth? I was thinking of the times I've been in your office. The first one, it says school nursing. In the past hour, I've seen 10 students, talked to 3 parents, 4 teachers, gave 2 meds, clean puke and pee. What have you done? And then the second one, which is very true too. So hopefully you're getting a chuckle out of those, because they did make me laugh.
Gina, it's your slides aren't progressing.
Oh, my goodness. Wonder how we, let me do a stop share. Okay, hang tight here. How about now, Carol?
No, there's nothing.
Well, I'm just sitting right along on my end here. You want me to cue it up again?
Do you have the little box down by, it looks like a monitor?
You want me, how about now?
No, there's nothing coming through.
Oh, goodness, guys. Sorry about that. Do you want me to stop share and then you bring them up on your end?
Let me see if I can.
You got it.
Can you can't see anything either, can you?
I cannot. But I'm happy to try it again.
Why don't you try it again, because I can't get it either.
Of course. Okay, so they're up, and then I'm gonna go. I'm going to close out of this PowerPoint and then open it again, and let's see if that does it. And if not, we can just talk. Okay, I'm going through them again. Are they advancing now, Carol?
No. Hold on just a minute. I may have to leave, because mine is doing what it did the other day. Hold on.
Absolutely. Time to put
Okay.
it. Yep. Okay.
Why don't you try to bring it up again?
Of course.
So when I brought mine up, it did what it did the other day. I have like a multitude of, if you can't, I'm going to go get someone to see if they can.
Figure it out. Okay, I'm seeing it here on my end.
The only thing we see is your
The
yes.
title, the
Yes.
title slide.
Mm-hmm.
Well,
all right. I'll be right back.
Of course.
If you want to go ahead and talk, you can.
Okay. Okay, well, you all hang on a minute. We'll see if we can't figure this out. Sorry about this. But as I was getting ready to say earlier, if you have any particular questions or concerns around children's oral health that you've experienced this year, that there might be questions that you can put them in the chat and we can start some dialogue there while we're waiting on Carol. I'm going to keep trying this as well.
Okay, Gina, hang on just a minute.
Hi, Gina. If you pull open the document that you would like to share, try to pull that open and close everything else. Is it on an online document or something saved in your computer?
It's on my desktop. It's a PowerPoint.
Okay, so open that up before you share and then click on share.
Okay.
And then that should be an option to share that document.
It's not even like showing up in the window now.
Refresh it, Gina, and see if that does anything.
Okay. If I refresh this, do you think it might kick me out of the main screen?
Maybe close the PowerPoint and then reopen the PowerPoint.
Mm-hmm.
And then try to share and see if it pops up as an option to share.
Okay. Okay, so now it's open. Now I'm going to go back in. I'm going to hit the monitor. I'm going to go to choose what to share. There it is. I'm going to hit share. Now it says
we see it. So what you'll need to do is just zoom so that we can see the slide a little larger.
Of course.
There, it's working now, Gina.
There's a zoom at the bottom right of your screen. So just make that slide a little bit larger so the audience can see.
Okay, how about I do this? Let me pull this down.
There we go. That'll do it.
Can you all see now?
See if you can make it just a little larger, Gina.
Of course. You know, you want me to do, if I get into here, can you see it full screen again? Can you see them now, Carol?
It's not full screen.
Well, okay, let me zip it up.
There. That's good.
You're liking that?
Uh-huh. You can go ahead now. Thank you.
Oh,
sorry.
No. All right, here's the funnies. Can you see them now?
Yes, we can.
Okay, all right. So anyhow, I've just shared this to say I have an appreciation of what you encounter on your day-to-day activities. You all are amazing. So when Carol asked me to talk today, I just thought we'll talk about two different things. The first is the relationship of oral health to the overall health of the school age child, and then looking at some of the roles that you can play by enhancing students' oral health. And here's the bottom line, is a student cannot be healthy without good oral health. So the picture that you see at the top, that you see healthy teeth and gums. The picture on the bottom, you see a child with active decay. The teeth are bombed out, and there's currently loads of bacterial infection, along with some gum infection. So when we look at some of the data around dental decay, dental caries, we know that is the single most common chronic childhood disease. It's 5 times more common than asthma, 7 times more common than hay fever. And we also know that children ages 2 to 5 that come from families of low income are 5 times more likely to have untreated tooth decay than children that come from families with higher income. In terms of oral health disparities, they are prevalent. We see them loud and clear here in West Virginia. This is kind of the Pareto principle of 80% of the decay happens in 20 to 25% of the population. The most vulnerable children are families, again, with low income, racial and ethnic minorities, and those with disabilities and complex health conditions. So we'll kind of make up for lost time here, Carol. I'll just kind of speed through a few of these. I do want to take a few moments to talk about why teeth are important, specifically primary teeth. You can see the little blurb in the upper right-hand corner here. Why is taking care of primary teeth, baby teeth, so important if they're just going to fall out anyway? I know you've all heard that for probably more times than you care to count, but primary teeth are important. They help in jaw development. They help give the shape to our face and form to our face. They are very they're vital for eating, for speaking, for smiling. They're extremely vital in terms of self-esteem. You've all been in classrooms, I'm sure, where you've seen children with the picture I showed you before of bombed out teeth. Those children are not super confident children. They'll have their hands over their mouth. It does affect that has psychosocial implications and affects their self-esteem. And again, it affects their overall health. You can't be healthy without good oral health. That's not Gina Sharp saying, that's actually former Surgeon General C. Everett Koop, who said that several decades ago. And then the primary teeth are important for holding space. The picture on the top that you see, that's a Panorex X-ray. We take those routinely. I'm sure you've all had those films taken routinely on yourselves as well, hopefully. But I want to show you, I don't know if you can see my cursor moving here. Can you see that, Carol, when I'm moving that up and down?
Yes.
Yeah, fantastic. So there is a very small space there. What you see is a space right underneath of it. That's a permanent tooth. That primary tooth, right where my little cursor is, that primary tooth was bombed out, had to be removed early before it naturally exfoliated. And then without a spacer, everything migrates toward the midline of your mouth. Everything just collapses. And so when that permanent tooth comes in, it's either going to come in toward the tongue side of your mouth, or it's going to come in the lingual surface, or it's going to come in toward the buccal surface. And it's just setting a child up for malocclusion and some serious crowding. So looking at the effects of tooth decay on children's health, I don't know where people get this mindset, but again, with primary teeth, with baby teeth, they think, I guess because they're baby teeth, they feel they don't have nerves, or they can't be a source of pain and discomfort, but they most certainly can. They can create a raging toothache for a child. So those primary teeth are very, very important to take care of. Remember, and I know you all know this, that dental decay is an active bacterial infection. When you look at this, I'm going to drag my cursor again here. I don't want to make you dizzy, but I do want you to see this. On the upper arch here, all of these teeth that are affected with decay, the bacteria that cause that will spread, through the saliva throughout your mouth. So when a child is treatment planned, if they have one active carious lesion, if it's not taken care of, that bacteria can spread through the saliva from tooth to tooth to tooth. And it's the same when they start getting into mixed dentition. When the permanent teeth come in, if they have bombed out primary teeth, baby teeth that haven't been fixed, well, guess what's going to happen to the permanent teeth? There's a propensity of decay for the permanent teeth as well. So it's just a very vicious cycle. If it's not treated, it can, as you can see here on the slide, I'm not going to read it all to you, but again, that bacteria can spread from tooth to tooth. If it's not fixed, it can result in a child making poor nutritional choices, eventually failure to thrive, and then again, a high risk for developing tooth decay in the permanent teeth. And this is, I've always thought this is such a sad slide. It makes me sad every time. Because I saw this many, many times in my years in pediatric dentistry. If a child came in with this facial cellulitis, this is life-threatening for a child. I hope to goodness that you've not seen this present in your offices, in your school setting, if a child comes in with this, because that child is in dire danger. That needs to be taken care of ASAP. You know that that space between the oh my gosh, the sinus space and the base of the brain is not far away. So you know, that is do not pass go. That child needs to get that tooth taken out quickly. That's causing that infection. But it is very, very costly. You can see the second picture on the slide. We call those silver stars or silver hats. Those, the formal name is stainless steel crowns. That's how we treat permanent teeth, or excuse me, that's how we treat baby teeth until the tooth can naturally exfoliate. If the tooth has decay on multiple surfaces of it, you have to put a stainless steel crown on it. And then when that tooth comes out, the whole crown comes, the stainless steel crown exfoliates with the natural baby tooth underneath. Whoops, goodness, sorry about that. Now, why? I just switched those up. Oh my goodness, Carol, that thing is being very sensitive, but that's okay. We'll get it. We'll power through. And in the picture on the lower right-hand side, I'm sure, unfortunately, you've seen this as well. This is early childhood caries. And this is, if I was in the room with you, this is where I would walk up and put my hand over the slide, and I would just show you the top third of the teeth. If you would not lift the lip, or you would never see around the gum line, you would never know that all of that decay is there. And I cannot tell you the amount, many, many times a child would be in the chair and I would lift the lip and the parent would be like, oh my gosh, I had no idea. You know, they know every freckle on the kid, but they had no idea that this was going on in their mouth. But this, it can be a very, so it's a source of infection. Let's just put it that way. So again, I think we hit this one already. I moved it around. And then what we would never want to see is what happened to DeMonte Driver in Maryland, in our neighboring state of Maryland. And what happened was this child developed a tooth, well, he had a cavity and lost his medical card. There were just many factors that went into this, but the ultimate ending was a tooth that could have been restored. I mean, it should have been had a sealant on it, but it wasn't. It had a decay, wasn't restored, ended up in an abscess. The child died from an abscess tooth, from a brain infection. So we would never, ever want to see that in West Virginia. Has that happened in West Virginia? Well, we know from how ER coding is done, it's not coded to, you know, death because of a toothache or an abscess tooth, but yes, it does happen. Yes, it has happened in West Virginia. This is kind of older data, but it's still pretty, I think it's pretty much status quo to what we see right now. And I had two thoughts to share with you on this. And this was pre-K oral health surveillance. And what you can see here with the pre-K, there was about 56% of children in that pre-K population that had already had caries experience. Is that, to me, that's just, I mean, that's just mind numbing. 56% of our pre-K kids have already had cavities. And what's the kicker about that, and I'll get to it in a minute, is this is when we talk about childhood diseases, and dental caries is the #1 childhood disease. It's also 100% preventable. So we should not be seeing this at 56%. And the other thought that I wanted to share about this slide was, when we talk about oral health surveillance, oh my gosh, do we appreciate our team at Marshall. There's 4 of us hygienists that have been responsible for conducting statewide oral health surveillance for years. We're not now, but we have been. And that it's so imperative, those partnerships that we have with you all as school nurses when we come in to do those oral health assessments, because that data is what goes into the CDC portal, is what we collect in the classroom. So, thank you so very much for your partnership and working with us in the past. We really appreciate this. So again, the good news is tooth decay is not inevitable, it's preventable. And I'm going to talk a little bit, I'm not going to get like too far in the weeds in terms of like cariology and micro, but I do want to talk a little bit about like the whole caries process. The bacteria that causes tooth decay is not present in the newborn. It's transmitted from the mother to the child. And you can see the picture here on the screen at the very bottom that mom has the baby in her arms and the bottle in the baby's mouth. And where's baby's hand? In mom's mouth. Where's baby's hand going next? In baby's mouth. So the mom transfers the bacteria from her mouth to the child. And that's how we that is how we acquire the bacteria that cause decay. And it's called Streptococcus mutans. It's the name of the bacteria. So what happens before the first tooth erupts, and as soon as the first teeth erupt, the bacteria, just kind of adhere to it and start to colonize. But before those primary teeth erupt into the mouth, the baby just swallows it, and it's part of their normal oral flora, and it doesn't bother their gut at all. But once we have the teeth in, then we have the bacteria. So then we start feeding them with the foods that we eat. So you have the bacteria, then all the things that, those yummy carbohydrates that we like to eat, kids like to eat, potato chips, goldfish crackers, all the things that we like to drink, sugary sweetened beverages, which we'll talk about in a minute, they produce an acid. So we've all got the bacteria in our mouth, and it's 2:43 in the afternoon. You all have been at the computer all day. You may or may not have brushed your teeth. I'm not going to ask for a show of hands. I can't see you anyway, so I guess you could show your hands. But if you take your tongue and run your tongue over your teeth really, really slow, if your teeth feel like they're growing fur or wearing socks, that's a bacterial oral biofilm. That's the bacteria in your mouth. And then we feed it with food, and then it spits out an acid. So that acid attacks your teeth for anywhere up to 20 to 40 minutes. Whew, man, that just buzzed right along, but that's what I was going to say anyway. So there we go. This is a little bit different for me navigating this way, but just bear with me. Okay, so you all know this, almost all foods contain sugar, and it doesn't even just the least bit, like in the macaroni and cheese with 1/4 of a teaspoon of sugar, that's enough to initiate the bacterial process. Now, I find this stuff absolutely fascinating. I hope you do too. The pH in the mouth for enamel dissolution to take place has to be about 5.5. So you can see kind of the progression of decay, the decay process, and this is what happens. This acid is so strong that it eats through the enamel. On the top right, you can see the kind of chalky white areas around the gum line, and that's called decalcification. The tooth it's not fully decay, but the decay process is starting. And then the second picture, you see those brown dots, those pitted areas, and that's called cavitation. So the decay process, it's already broken through the enamel. And then on the lower right-hand side, you can see those teeth, the lateral incisors are just almost completely bombed out at the gum line. And then the 2 front teeth are affected with decay as well. But this picture is another sad one for me, because you can see This child's about 18 months old, and unfortunately is already going to have to go to the OR to restore that. That's not a dream for anyone. Anesthesiologist doesn't love it, and neither does the pediatric dentist who's going to do that. But anyhow, so that's kind of like the pH of things that we drink that we're putting in our mouth. We just never think that, like, sodas have a pH of 2.5. They're highly acidic. So again, here's what the progression of tooth decay looks like. Those white chalky areas, looking at that first picture, you would never, ever see that decalcification if you didn't lift the lip and pull down and look around the gum line. And then, of course, the cavitated lesions, the second picture. The third picture, that's what we call early childhood caries. More than likely, that's caused from putting the child to bed with, they're together, all right, the sippy cup and the child in bed all night. And then that's another picture of early childhood caries on the right side. Okay, and then unfortunately, probably what you're familiar with seeing in your offices and as a school nurse is the picture on the far right-hand side of an abscess. So you can see that tooth is abscessed, and the fistula, the draining fistula, has broken through the cortical bone. And that child may or may not be in pain if the abscess is draining. So again, this is what early childhood caries looks like. Again, a bacterial infection has to be fixed. And we know, if a parent comes at you and says they're just primary teeth, they're primary teeth, but they still have nerves. They still can get infected. They still could cause bacterial infection that can access the bloodstream and spread. And then, of course, the picture I showed with you, or the story of DeMonte Driver, where the child died from a toothache. Holy cow, we would never want that to happen on our watch. I'm not sure if you all have seen this. I felt it's important to share this. This is what it looks like. I guess working in pediatric dentistry for almost 10 years, we had a lot of OR cases, and this is what it looks like when a child has to go to the OR to have the teeth restored. So unfortunately, this child, with primary teeth, there's 10 on the top and 10 on the bottom. This child might have been around 3 years old, and all 8 of the primary teeth that are bombed out have got to go. He's lost them all. So think back to what I told you at the very onset of this. You can't be healthy without good oral health, but those primary teeth, those primary and permanent teeth, how important they are for speech development, how important they are for nutrition, all the psychosocial implications, and what's going to happen when that child loses all 8 of those primary teeth. We don't put in, little baby dentures. It's a sad state of affairs. And again, the takeaway is this is 100% preventable. We should not be seeing this. It is multifactorial, and we'll talk about that a little bit more in a moment. So I can't see you, but I know one of the good, best things about a good presentation is audience participation. So you can just kind of like shout this out in your mind. If there are 3 things that you just learned about oral health, I hope there are 3 things that you've taken away thus far. And maybe it's, bacterial, dental caries is a bacterial infection. It can be spread from tooth to tooth. And here's another funny for you. Oh, I hope you're laughing because these things crack me up. All right. And then kind of down the home stretch here, I think we have until 3:15, but I do want to do some time for Q&A. I want to talk a little bit about the role that you can play in enhancing students' oral health. And oh my gosh, you all, this is one of my favorite things I've ever worked on in dental public health, and it's called the Rethink Your Drink campaign. It's probably not new information to you. It was actually started, I think it was I can see my notes here, and I bet you can too. The California Department of Public Health started the Rethink Your Drink campaign. The aims are really quite simple. It's reduce sugary sweetened beverages, SSB consumption, and then increase water consumption. And I kind of put this piece on the end of it, specifically fluoridated water. And I'm going to talk to you about why fluoridated water. Actually, I'm going to talk to you about that right now. So when we look at dental public health measures, the CDC has 2 evidence-based oral health activities that they promote. One is dental sealants, and I'm sure some of you who have school-based services are very familiar with dental sealants. They're super fantabulous. I have dental sealants on my teeth. I love them. I hope you do too. And the other is community water fluoridation. And community water fluoridation is so, so important. It reduces dental decay by 25% from just drinking fluoridated water. Dental decay by 25% in both your mouth as an adult and children. So we need to make sure that we protect community water fluoridation at all costs. And Carol, you don't have to talk right now, but maybe if we have a little time at the very end, we can talk about the community water fluoridation rollback challenge that we helped thwart in Harrison County, where that was a real kick in the pants, but we were successful. And now community water fluoridation is still alive and well in Harrison County and still serving as it is intended in terms of fluoride reduction, or excuse me, caries reduction. So some of the other benefits of Rethink Your Drink and promoting water consumption, you all know this better than I in terms of like how important water is in improving digestive health, keeping children's growing bodies hydrated. I thought this last one was pretty cool. It also improves children's visual attention and fine motor skills. So it's extremely important that they are hydrated and drink water. So kind of the core principles, if you will, of the Rethink Your Drink campaign. This is just one of the informational brochures that come with it. They're on the left-hand side of the slide, and it's not all about the relationship between SSBs, sugary sweetened beverages, and poor oral health, but also you can see here, bad for your teeth, but also increases the risk of becoming overweight or obese, and then, of course, increasing the risk of type 2 diabetes. And these little brochures are packed full of information. My most favorite graphic is the second one. It says you wouldn't eat 16 packets of sugar, so why in the heck would you drink them? And it just kind of we use this as a point for people to look at this and think about sugary sweetened beverages in a different way. You know, that's how much sugar is in it. You wouldn't eat it, so why would you drink it? This is actually a Rethink Your Drink kit. It's put out on a kind of like a corporate boardroom table there. You can see it's big. I have this, and if you ever want to do a Rethink Your Drink campaign, or or something around, there's a National Water Week. If you ever want to promote this with your students, you just hit me up and I can ship this out to you. I'm glad to lend it to you. Just, ship it back to me. That would be all I would ask. Here it is, kind of up close and personal. And of course, you can see the message that we're driving home is water in any size has 0 teaspoons of sugar. The only thing that I really don't like about this is it shows the bottled water. That's really not super environmental friendly. We want them to fill up their water bottles at the water stations, and I'm going to talk about that right now. So our West Virginia Oral Health Coalition has done some pretty cool work around the Rethink Your Drink campaign. We had a video and a poster contest a couple years ago, and we had quite a few organizations that hopped on board and endorsed this and provided funds. Sisters Health Foundation has been wonderful to work with, the West Virginia Dental Association, the Benham Foundation, Thrasher Engineering, the School of Dentistry. And for the, we had elementary school, middle school, high school. Those were our categorical areas. So whoever won the poster contest, whoever won the video contest, their school won a water bottle refill station that you can see up here on the right-hand side. So I was getting some like pre-session heckling from one of my favorite nurses ever, Nurse Sherry Hudgens from Wood County. Whoop, whoop. And so Nurse Sherry and I have been working on the Rethink Your Drink, and we, with Nurse Sherry's help, secured funding from the Sisters Health Foundation. And while this isn't applicable to all of you, the students in Calhoun, Jackson, Pleasance, Ritchie, Roane, Tyler, Wirt, and Wood counties, their schools are getting, as shown here, Exhibit A, water bottle refill stations. And Nurse Sherry, if you're listening and you check your email later, I just submitted Jackson County's water bottle refill station order today. So their water bottle refill stations will be being shipped out soon. So I say that just to say that there are partnerships available. So, Nurse Sherry is a superstar, and I so appreciate her. And I'm willing to partner with any of you as well if you want to look at obtaining water bottle refill stations for your students. And with that, kind of like down the home stretch here, I wanted to talk about Sisters Health Foundation. I shared the counties that they cover, their catchment area. They're not statewide. And the next one, and Carol, I think I've shared some of this information with you with the West Virginia American Water. They're not statewide either, but I do want to tell you all this. They do have a grant opportunity that's coming open in the next couple weeks. On August 1st, it closes on September 30th, where you can write for a grant for a water bottle refill station in your school. You don't have to worry about the narrative. I've got it. Nurse Sherry and I've already pounded that out. And if we can pass it by Sister Molly, I can guarantee you're going to get 99.9% guarantee you're going to get funded. So if you're in the counties, pop on the American Water site and see if you're in one of those counties. If you are and you're interested in this, I will send you all the text, the grant narrative. You just cut and paste it, and I'll help you in any way I can. The other opportunity is through the Highmark Foundation, and they have something that's called the School Grants and Awards Program. And we just, I worked with, oh my gosh, what was the school in Kanawha County? George Washington High School. I don't think I'm making that up. I don't think so. But they just were awarded a grant for a water bottle refill station. So if you see a grant opportunity and you're like, oh man, I don't have time to write that, or I don't know how to write that for, any type of Rethink Your Drink initiatives or water bottle refill station initiatives, hit me up. I'll help you out. And then switching gears really quickly, I know we only have a few more minutes. I do want to just kind of mention that with Department of Ed content standards and objectives, oral health is mentioned. It spirals, follows the child throughout their student experience from, pre-K to graduation to 12th grade. And there's oral health throughout the years. So you can incorporate those CSOs as they pertain to oral health in any type of billboards that you do. And I put the link that details all of the content standards and objectives around oral health on this slide. And I can PDF this and send it to Carol, and then she can share with you all. Or I have my contact information here coming up in a few slides, and I can send you the slides. But you don't have to go dig them for them. They've already been teased out for you. So this is another way to, promote oral health as part, and it's so important we don't think of it as siloed, because oral health is part of our overall health and the student's overall health. And again, I know I've said it like 10 times, when we say it again, a student cannot be healthy without good oral health. And then I'm so proud of my colleague and her work with the Mon County Health Department with the mobile dentistry Smile Express. I hope if this is something that's in your county that you support this, because like we talked about with dental decay being multifactorial, a lot of it is diet, but some of it, it is access to care. So some children, the parents are they're not going to take them for whatever reason. They can't get off work or they don't have transportation. So those school-based services are really so vital and the only services that some children will ever receive. So if there's an opportunity to partner with the Smile Express with Mon County Health Department, I urge you to do so. And again, you don't have to jot all this information down. I'll share these slides with you, but you can see Tiffany shared the 2019 executive summary, and the program has just really taken off. It's, it's a kind of her, what's that? I can't think of the word for it, but her baby, this is her, she saw this thing through from, inception all the way to what you see there on the screen. And she's poured her heart and soul into it and provides just the best of care. So I know I'm kind of like jumping all over the map here, but I wanted to make sure if there was an opportunity that you could promote oral health, that I talked to you about it today. Our West Virginia Oral Health Coalition does have a social media campaign, and this is totally hot off the press because we just put this QR code on here this morning for you all. There are 4 main areas of our social media campaign. The first one's probably not going to be really, you're not going to be too interested in it, in the importance of resuming dental care, but community water fluoridation, HPV and oral cancer, and then rethink your drink messages. But you can use these graphics if your school has a Facebook page, or you have electronic newsletters that you send out to parents. Definitely use these graphics and these messages. They're free. And I'm just showing you a snippet here, but what's really cool about this is when we worked with the consultant to put this campaign together, he was pulling images from like iStock, or forget what all portals he was using. But I was like, you know what? Why are we not using West Virginia people? So every person that you see here on this screen, and then once you hit, you use the QR code, they're all West Virginia practitioners and patients. So I'm so excited to share that with you all. And then for those of you who have active, and maybe you have to, I'm not sure the policy, how that works. Carol, maybe you can like line me out here in a minute. With school wellness councils, I know with Head Start, they have to have a health advisory council, but definitely encourage a dentist or a dental hygienist to join your wellness council. They can provide a wealth of information, whether it's around community water fluoridation or school-based services, sealant programs, mouth guards. I've done mouth guards programs for Harrison County in the past, but there's a letter template here that you can, modify and bring into your school and invite them to come join you. And then almost last but not least, are some oral health resources. And for those of you who like to get in the weeds with the scientific literature and evidence-based practices, there's no shortage of them around children's oral health and the relationship between school performance, ability to learn and such. So there's a few of them there. And then lastly, I did want to just mention about dental trauma and dental first aid. I'm sure you have this in your offices. If not, man, these are fantastic tools. The first one is from Rhode Island. It's the dental trauma decision tree, and it just walks you through like what to do. But there's dental trauma and child's a valsed tooth. If it's a primary tooth, of course, you never put it back in the socket. If it's a permanent tooth, you do. It just kind of walks you through those decisions. And then this one on the right hand side is from my colleagues in Ohio, and it just has an action plan. But these are really nice to have, kind of at your desk if a child comes through with an avulsed tooth or, potential mandibular fracture or whatever could happen, who knows. So I will end with that. There's the question slide, and there's my contact information, and I'm going to stop share and get out of there. Okay. There we are.
So I was going to say, if anyone has any questions, let me look in the Q&A. What we did the last time was just put questions in the chat. So we had a lot of good information. The sugary drinks, I know, are a plus in a lot of the schools, especially the high schools, the kids want those sports drinks. And so if you guys have any questions, please go ahead and just put it in the chat. And then we can, Gina can answer those for you.
So while we're waiting for them to chat, I just, again, Carol, thank you so much for the opportunity to join you all this afternoon. I hope that's what you had in mind. I know we have a few minutes left. If I didn't hit anything that you wanted me to cover, let me know and I can do my best to cover it here in the next few moments.
No, the only thing you might mention is, where we've talked in the advisory, the oral health advisory, about the, like we talked, the students aren't, they aren't getting seen, and how school nurses can help and improve those students.
Yeah. So, and if you have specific examples that you have in mind, let it rip. Oh yeah, Rebecca, have you seen an increase in caries with COVID? Yes. And I was on a webinar with Head Start, and the pediatric dentist coined this phrase, and I was like, oh my gosh, isn't that the truth? COVIDies. Instead of cavities, he called them COVIDies because of children not getting ongoing care. And as I shared with you, cavities is a bacterial infection, and how it just went wild in children's teeth. So have you seen an increase in caries with COVID? The answer would be yes. How do you get students to go back to the dentist? And you know what? So I guess I should probably take back some of that information I said about that our social media campaign, and maybe that wouldn't be of great interest to you all, but maybe that one is, because those are messages that we can share with parents to say, yes, it is safe to go back to the dentist. In dentistry, we have the ultimate, like, in universal precautions, even before COVID. We just have like the bestest of safety records. So how do you get students to go back to the dentist? We want to make sure that the parents are getting that message that yes, please resume regular dental care, including, any outstanding treatment plans. And then Sherry's asking, how does West Virginia compare to other states regard to water fluoridation? Well, thank you, Nurse Sherry, for that fantastic question. And I'm delighted to say that we are in the very top of doing it well in terms of community water fluoridation rates. So maybe I believe in the top 9. We were in the top 5. I think we popped down to maybe number 9 right now, but we have a very high percentage, like 91.9 is what I'm thinking, of our water systems. Now, let me be clear with this. 91.9% of our community, our public water systems that are fluoridated. But we know not all children access public water systems. So some of them are drinking from wells or, cisterns or whatnot that may or may not be fluoridated. But in terms of the public water systems, we have a high percentage that is fluoridated. So, and then Carol and I had a very interesting experience. I know we only have 6 minutes left, but I do want to talk about this because you all talk, man, as school nurses, you are looked at and regarded very highly among your peers, and Carol came with me to provide expert witness to the Clarksburg Water Board when we had a rollback attempt to share information around evidence-based information around community water fluoridation, and the board decided not to vote to discontinue community water fluoridation because of the role of a school nurse. So your voice is very valuable, and the partnership, I cannot tell you how much I appreciate it. And all the children, like, I mean, she was part of saving that for thousands of children in Harrison County and adults, families, that we received the benefit of community water fluoridation. So thank you, Joanne. Oh, that was fantastic to hear. And so I don't know if I answered all that as best I could of resuming dental care. So we want to make sure that if they've stalled out with their care, that we jumpstart it, that we can give them information. And I feel bad now. I take all that back about what I said, that first message on the social media campaign might not have been appropriate for you all, because I'm hearing that it very much is. So please take a look at those messages. And you can, again, if you have Facebook pages or Twitter accounts, or Facebook, Instagram, blast them out there. They're free. Download them and they're free. And who knows, maybe you'll see one of your students on there.
The other thing I wanted to highlight, now is the perfect time to get a water bottle refilling station, because we're going to continue more than likely with no water fountains. I don't 100% know about that, but nurses, go ahead and get that out. You've got work on it over the summer. Is that a possibility, Gina? What is it, from August the 1st through
September 30th? Yes, and it was with the West Virginia American Water, and I have the list, Carol, that the contact there sent me, and if you want to share that with your nursing colleagues, we can be at the ready. You know, I have the, like I was sharing, I have the grant narrative. You don't even worry yourself about that. I have that. I can send it to you, and you can just plug in your information, and we can see if we can snap one up for you.
So if there's any nurses on here that want that information, just email me. And I've already gotten I want your PowerPoint. So Gina, I have it. If you give me permission to,
oh my gosh, yes.
Everyone that wants it, please just email me and I'll get that information out to you. I know I've had some, I haven't received this, but I want to wait until I have all of them so that I can send them out to you guys.
Yeah, that sounds really good. I know we have 2 minutes left, and I don't think I missed any questions or comments in the chat. Again, thank you for all you do. I've been in your offices before, and like, you just got to be like dragging home at the end of the day. You are busy individuals.
All right, then, if there's no other questions, thank you, Gina. It was a great presentation, as always. And for school nurses that are on here, thank you so much for attending and coming to the conference. And I really hope you had some good learning experiences. So for now, we'll just say goodbye, and Gina, I'm sure we'll be in touch.
Sounds good. Thank you very much.
Bye, everyone.